Do not settle without health care protections. That's what a coalition of health organizations are urging their premiers to do in their battles with major tobacco companies. The three big tobacco companies have been sued by all 10 provinces for more than $500 billion in total damages. But a 2019 Quebec ruling granted the companies creditor protection, which has been extended repeatedly. That protection prohibits any lawsuit against the tobacco companies from proceeding and only ends with a settlement. One of the organizations signed to the joint letter is the Canadian Cancer Society. Senior policy analyst Rob Cunningham is joining us this morning from Ottawa. Welcome.
Good morning, Anne-Marie. Good to be with you.
Just to bring everybody up to speed, the first province to file a suit against the tobacco companies was BC. That happened in 2001. How did we get from there to where we are now over the course of more than 20 years?
Well, it has taken a long time. I mean, the tobacco companies have this unparalleled history of wrongdoing in terms of their advertising to underage youth, advertising to women, public relations campaigns to deny the health effects, opposing regulation. That's why provinces sued. They worked their way through the courts. And then in 2019, there was this Quebec class action that had a judgment of $13.5 billion, very critical of tobacco companies. And that prompted the tobacco companies to seek the bankruptcy protection, the creditor protection that you mentioned. And that began this process of negotiations. Negotiations have been going on for the last 4 years.
Well, since creditor protection was extended to the big three tobacco companies, as you mentioned, they've been in negotiations with the provinces. What do we know about those discussions?
We know nothing. And that's a tremendous concern to us. In the United States, where they had similar lawsuit settlement negotiations, the health organizations work very closely with state governments. Here, we have no idea what's happening in the negotiations. We don't know what the priorities are in terms of governments, and it's big tobacco at the table with provincial governments. Health organizations are excluded, and that's why we put out this open letter today to urge provinces to make reducing smoking a priority in the settlement negotiations and in the outcome. In terms of a settlement.
The concern here with outcome isn't about the money, it is about healthcare protections. Tobacco use is the leading preventable cause of death in Canada. It's linked to the deaths of 48,000 people every year in Canada. What does your coalition want to see included in any settlement that happens between the provinces and these three companies, if that's now the route we're forced to take?
Yeah, we want a series of measures to reduce tobacco use, the establishment of a fund independent of government that is well-funded with sustained financing, at least 10% of the proceeds of the settlement to reduce tobacco use over the long term. There should be a ban on all remaining tobacco promotion, which does continue. There should be targets set for tobacco reduction. If those targets are not achieved, tobacco companies should be required to pay substantial extra sums. And all of the secret internal documents of tobacco companies, 6 million pages, have been provided in this case in terms of pretrial procedures. All of those should be made public, so we know the marketing strategies. What did the tobacco companies know? When did they know it? In the U.S., 40 million pages became public. We should have the same approach in Canada.
Yeah, as you point out, there is precedent for this, although not in this country. Many of the things that you're seeking, including those restrictions on tobacco promotion and the publication of internal documents from tobacco companies, those were included in that settlement that you just mentioned in 1998 and 46 other states. So what do we know about the effectiveness of those measures in reducing tobacco consumption? It's one thing to ask it, it's another thing to know if it actually works.
We do know that the U.S. settlement had some impact in terms of reducing smoking. But if we had a much better worded settlement, we could have an even greater impact in Canada. We know from the evidence that promotion increases smoking. That's why we need to have a regulation to control it. And we know that the measures that we are asking for are evidence-based. They will have an impact. There's a historic opportunity for provinces to really control the industry so that they do not have in the future their behavior of the past. It cannot be, in our view, business as usual after a settlement.
Thanks for this, Rob.
Anne-Marie, thanks very much.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.